Hi, this is Dr. Catalina Thiersen. I am presenting in conjunction with Avanti Animal Health Products in terms of a case study that we did on a particular thoroughbred, 4-year-old, that was off the track with a carpal chip. This horse was not a candidate for chip surgery, and therefore we had to find a regenerative way to help this particular young gelding. His history is he was a 4-year-old with a reasonable racing career and record. The track vet suspected a carpal chip, and he was actually rested on the track for 2 months. He was then rehomed with full disclosure because his soundness remained in question when he was returned to racing. The new owners wanted to do something for him and give him a chance, so we opted to take radiographs to establish how bad the injury was, and these were taken on the 10th of March 2021. On this radiograph, you can see a very, very clear chip, and you see our 2 rows of carpal bones. There's also some changes in the proximal carpal bone, which is just above our chip. I will go into further detail of this. When we move on to what is called our dorsal palmar view and our flex lateral view, I'm going to direct you to the lateral aspect of the dorsal palmar view, which is the radiograph that is to your left on the screen. Looking from left to right, on the outside of the left-hand picture, you will see some changes to the edges of the carpal bones, and if you look very, very carefully, there is a section on the distal portion just above the cannon bone between the two carpal bones. You can see a zone that is a lighter or darker, sort of a lighter and darker color that looks like a piece of bone has been eaten out. That is DJD setting into the joint. On the flexed view to the right, to your right on the screen, you will then see the carpal bones move apart, and you can see the chip changes on the front of that carpal bone. I'm going to go into more detail with this as we go through the progression. The treatment was installed, and we used a syringe of Avanti Optivisc 40 and 2 vials of Tronmeal initially. The young horse was placed on Avanti Pento joint with immediate effect on the treatment day, and then 5 days post-treatment, thereafter monthly. To your left on the screen, we see the original radiograph that has marked with a green arrow where our carpal chip actually is. And just above the chip, you will see the changes on the other carpal bone. And the image to the right of the screen, you will notice that we have our 5 weeks post-treatment radiograph that now shows that our chip is no longer free-floating, and some of the roughened edges are starting to smooth on the carpal bones. We did a second treatment on this young horse in July 2021, in which we used 2 syringes of Avanti Optivisc 40 and 2 vials of Tronmeal. We continued our loading that we did initially, which was a penta joint on the day and then another penta joint 5 days post-procedure. We then maintained the horse on Avanti penta joint for another 2 months with the injections every month. On the 24th of August 2020, we took some more radiographs. On the left, to your left on the screen, you will see the original radiograph with a green arrow that highlights the chip. To the right of the screen, you will see the new radiograph that was taken roughly 5 weeks after the second treatment. Now we have almost clean joint edges, and no more floating chip around in our joint. The roughened edges on the proximal carpal bone has now been smoothed, that proximal carpal bone being the radiocarpal bone, and you can see where the chip is now incorporated into the lower carpal bone. I want to show you the progression of this case through the radiographs. So we've taken comparative, we put the radiographs up as comparisons. So when we initially look at our initial radiograph, which I've blown up to your right so that you can take a look at exactly where the pathology is, and I can highlight it to you, you will see on the edges of the carpal bone where the green line is, we see some roughening. And this is actually degenerative joint disease. And between the two carpal bones, you will see that slightly lytic area, which comes up a little bit darker, a little bit more blackened than the surrounding bone. That is actually bone being depleted underneath the cartilage layer. As we continue, we now see two radiographs side by side where the roughened edges have now smoothed. In the initial one on the left-hand side, you see that it's a little less smoothed, and then to the right, this is taken on the 24th of August, we have now got clean margins, and the carpal bone is actually smoothed off on the edges. So it has healed from this aspect, and we no longer have that lytic zone between the two carpal bones, which means the bone's actually restored. This is quite a blurry X-ray, and my apologies, they're difficult to take, but here you can see that there's free movement of the actual carpus, and this was actually taken after the first treatment. And you can see where the chip is now becoming incorporated into that distal carpal bone or metacarpal carpal bone. I'm comparing the three different images that were taken to you and just highlighting where the changes are actively occurring as we are progressing through the treatment of this particular joint. On the left, we have the initial X-ray. In the center, we have the second X-ray that was done 5 weeks after the first treatment, and to the right, with a green circle, we have the final image that was taken on the 24th of August. We can see how the joint has cleaned up. The roughened edges have become less roughened, and you can actually see where the chip is now being completely incorporated into that distal carpal bone. All in all, I have to say that we are ecstatic with the results that we have achieved here, and we couldn't have wished for better, and we couldn't have asked for a better outcome for this young horse who's now sound and about to start to work. We will be following up on this and actually sharing some movement videos on the Avanti Animal Health website in the future. I thank you for your time. I thank you for your attention. And I thank Avanti Animal Health for the opportunity to use their products and get these particular results. Thank you all.